Now I'd like to explain some data related to adolescent sexuality. So first of all, have you ever wondered exactly what percentage of students in grades 9 through 12 are sexually active? Well, if you look at this bar graph, which looks at the percentage from grade 9 to grade 12, you can see a clear, steady incline in the rate of adolescents who are sexually active from grade 9 to grade 12. So for the boys, by 12th grade, 44% are sexually active. For the girls, by 12th grade, it's a little bit higher, about 51%. And the overall total for both boys and girls is about 48%. So an easy way to think about it would be to just round it up to 50%. And you could think of it that about 1 out of 2, or about half of the students, are sexually active by grade 12. Now, this chart shows the rates for ages 15 to 19 for a few sexually transmitted infections, namely chlamydia, gonorrhea, and syphilis. So this shows the rates starting from 1996 up to the most recent available data, which is 2011. The blue line is syphilis, whoops, and you'll see that we basically eradicated syphilis. Gonorrhea, it's been holding steady here, maybe a slight decline in the rates. But look at chlamydia. This is very disturbing. You can see that, unfortunately, the rates of chlamydia have been going up. So we want to try to reverse that trend, and the best way to do that is to be sure to practice safe sex and wear a condom, which will greatly help to reduce the risk of contracting chlamydia or other sexually transmitted infections. Now, the single most common sexually transmitted infection is genital warts, or HPV. In fact, HPV is so common that nearly all sexually active men and women will get the virus at some point in their lives. One reason why this is a concern is because a correlation has been found for women between genital warts and cervical cancer. So that is one reason why it is concerning. There is a vaccine on the market now, but don't forget to wear a condom to help reduce the risk of spreading genital warts. Now, in terms of the pregnancy, birth, and abortion rates for US teenagers aged 15 to 19, let's take a look at this data. So this goes from 1976 to about 2010, 2012. So first of all, let's look at the pregnancy rate. So you can see good news that the teen pregnancy rate has been on a steady decline. What about the birth rate? Same thing, a steady decline, which of course makes sense because if you have less pregnancies, then you would have less births as well. And then also good news, the abortion rate has also been on a steady decline. So again, if you have fewer unwanted or unplanned pregnancies, then of course you'll also have fewer abortions to go along with that. Now, the reasons why we're seeing fewer teen pregnancies is largely due to education about how to prevent pregnancy by using birth control, and also by making birth control widely available. Now, what about this topic? This is a dark subject of dating violence. And this is quite sad, really, that 1 out of 4 adolescents report verbal, physical, emotional, or sexual abuse from a dating partner each year, according to the Center for Disease Control. So that is quite high and very disturbing. And we need to keep in mind that substance abuse is a major risk factor for dating violence. When alcohol or other drugs are involved, this increases the risk for dating violence. So the main takeaway point is just be sure to practice safe sex and make sure there is mutual consent. So keep calm and use a condom. This will reduce the risk for sexually transmitted infections and also for unplanned pregnancies. And then you'll want to always make sure there's mutual consent, that both people are willing participants in the sexual activity. And along with that, do keep in mind that if alcohol or drugs are involved, make sure that the person is truly consenting. If the person is severely intoxicated or under the influence of drugs, then they cannot give true consent. So please keep that in mind. Practice, wear a condom and make sure there is mutual consent.